The Honourable Kyle McGinn.
Thank you, Acting President. I too rise today to, in the brief time that's left, to put my comments on the record regarding this motion brought to the chamber. I'll probably speak specifically to the report and also Part A. And I too would join the Honourable Darren West in giving my thanks to all healthcare workers, particularly in the palliative care space in this week. And I want to go one step further and make a big shout out to the people working in the Aboriginal palliative care space. If you do get time to read this report, and I thank the committee staff for assisting because it was quite a extensive inquiry put into a very small time frame, which I think, given the opportunity to go a bit longer, probably would have found some more resounding results in there and probably a little bit more information around the recommendations. But one of the parts that I think is really important starts on page 85, which dives into palliative care for Aboriginal people. And the committee heard evidence of that Aboriginal people are generally underrepresented in the palliative and end-of-life care patient population and often have difficulty accessing palliative care services. There's another section within this report that touches on telehealth and an amazing step forward that we've had in telehealth, particularly in regional Western Australia in the mining and pastoral electorate, where it was a little bit of the forbidden fruit where no one wanted to touch it for a while, and then COVID come in and telehealth started to rocket a bit more. And there's some amazing telehealth setups right around regional WA that I think have taken a lot of pressure and stress off people that need to travel long distances to get to see professionals. So that is going to play, I think, a very important role through delivering Aboriginal palliative care, particularly in regions such as the Kimberley. And you go through this report and read particularly around where the committee managed to communicate with organisations, which I've said in this chamber before. I believe it was under the elder abuse report in the last government where it was very difficult to get hold of Aboriginal health providers in the elder abuse inquiry. And I think we had a little bit better success in this report, and I'll have to say with a lot of effort in trying to get that done. And the effort is needed in that space to ensure that the Aboriginal voice is put into these reports and these inquiries. So one of the recommendations, which I think is bang on and probably one of the best ones in the report, is palliative care units be designed in consultation with local Aboriginal community members and their elders. Very simple, you would think, but that's something that needs to be implemented to ensure that when we're creating these systems, the local community is part of that. Otherwise, we're coming in with an outsider's view in an ivory tower, dictating terms on how a system is going to operate. That doesn't work. Too many times do you see programs and projects implemented by federal, state or local government without interaction and consultation that just don't get utilised and end up being a waste of money. Then a new government comes in, gets rid of that program and starts another one without consulting. Palliative care is critical because the conversation around life and death is a big conversation. There's also cultural understandings that need to be taken into account. There is a huger debate to have here about dying on country and not dying on country. That's something that I know in the goldfields is a very split thing. There was a high percentage last year of people that wanted to go to palliative care units in Kalgoorlie to pass away rather than on country. But next time we get to talk about palliative care, I'll touch on that further. Thank you.